Your PIP assessment can feel scary, but it doesn't have to be. I want to show you exactly how to prepare. These 5 tips will help you present your case properly and give you the best chance of success. So in this video, I'm going to show what assessors actually you look for and what mistakes to avoid and the kind of mistakes that are likely to cost you points. So my name's Sakasen and I'm the founder of financialeducation.co.uk, and I've got over 25 years experience of supporting people on a range of financial issues. Now, let's get you ready for this assessment. So tip number 1, this is always describe your worst days and not your best. This is really, really important. So this is where most people go wrong right from the start. So you might feel tempted to show how well you're coping, but that's just your brain trying to protect you. It actually hurts your claim. The assessment looks at how you are on most days, not your best days. So if you can do something twice a week, but not the rest, say that. The assessor needs to hear about your limitations and not your achievement. See, what they're not doing is testing your character or judging your strength. They're scoring how your condition affects specific daily activities. So tell them about the days when everything's a struggle, not when everything's really easy. See, that's the honest picture that they need to help make a fair decision about your claim. Tip 2 is to never give short yes or no answers. See, the assessor is going to ask you some questions. On the face of it, sound really, really simple and straightforward. You know, like, can you wash yourself? Can you dress yourself? Can you cook? But if you just say yes, that's 0 points scored. So not helping you get the points that you need for your PIP assessment. So what you need to do is explain exactly what happens when you try to do something. So, you know, do you need to sit down halfway through getting dressed? Does washing your hair leave you exhausted for hours afterwards? You know, can you only manage to wash your hair twice a week instead of being able to do it daily? Do you need someone to remind you to do something or help you to start to do something? Now, this is the kind of detail that really matters and is what gets you the points that you need to pass your assessment. So every answer that you need to give needs to paint a full picture of what your daily reality is really like. Third tip is to take someone with you to the assessment. So you're allowed to have someone over the age of 16 attend with you. So this person could be your partner, it could be a friend, it can be a carer, you know, someone that you trust. Make sure you tell the assessment provider before the day that someone's going to come along with you. But why does this matter so much? Well, you might forget some really important details. You know, because assessment can make you nervous, it can certainly make you quite stressed. Your friend can be there to remind you about things that you've forgotten to mention or things that you really need to highlight. They can also take notes during the assessment for you, and they can back up what you're saying if needed. Just make sure, however, that they know your condition and how it really affects you. They need to be in the room with you, not waiting outside, and they need to be supportive. Tip number 4 is to take your PIP2 form and supporting evidence with you. So before the assessment, gather everything that's going to support your claim. So bring your completed PIP2 form so you can refer to it if you need to during the assessment. So this helps you stay consistent with what you've already said. Make sure you don't contradict yourself. Also, take any medical letters or reports that you haven't sent yet, which again can help support your claim. Take prescription lists, any consultant letters, care plans. Take everything that's related to you. And if you keep a diary of how your condition affects you, take that along as well. That's all going to be helpful. So the assessor can't use evidence that they haven't seen. You can also take notes about what you want to explain so you don't forget everything. And make sure you have proper ID like a passport or driving license with you as well. And remember, you can also claim back travel costs to the assessment centre. A lot of people forget they can do that and don't. The final tip is to explain how long tasks take and what happens after you've done them, and really set this out clearly. See, the assessment isn't just about whether you can do something, it's about whether you can do it safely, repeatedly, and reliably. So can you do it to an acceptable standard? Does it take you much longer than it should, or longer than it used to take? You know, what happens to you afterwards? Do you get really tired? Are you exhausted? See, someone might be able to walk 50 metres eventually, but if it takes them 20 minutes and leaves them in pain, that counts. You know, that's evidencing how you find it difficult to do. Likewise, if cooking a meal exhausts you so much you can't eat it, well, tell them. See, the scoring looks at whether you need aids, supervision, or prompting to do things. So explain the full reality of what each task actually costs you in terms of time and effort. Now let's summarize the 5 tips. So the 5 tips that will help you get a fair assessment. So always talk about your worst or average days, not your best. Again, I'll repeat to myself, but that is really, really important. Give detailed explanations, not just short yes or no answers. And take someone alongside you, who knows how you're affected by your condition. And take all the forms and medical evidence that you've got to the assessment to help boost your chances of a successful claim. And also explain how things take, how long it takes, and how they affect you afterwards. See, the assessor, as I said before, is scoring based on whether you can do things safely and reliably, not whether you can just about manage them once. So you can get more support from the UK Care Guide website or from Citizen Advice or Scope. So good luck with your assessment.